Hello, everyone, and welcome to our latest online event, part of Become a Bobcat, a virtual series. Welcome to your Saturday. Thank you so much for taking some time out of your day to spend with us here while we, in just a moment, start talking about the UC Merced Pre-Health Advising program. Before we get started, let me give you a couple of quick tips. If you'd like to adjust your audio settings, you can do so in the lower left corner of your screen by clicking the audio settings button and making those adjustments there. If you would like to adjust the size of your screen, you can do that by clicking View Options in the upper portion of your screen. Lastly, and most importantly, we definitely hope that you send us your questions today by using the Q&A button at the lower portion of the screen. Simply click that button, send in your questions, and we may answer those behind the scenes as well as at the end of this event in a live question and answer session. My name is Ricky Hill, and I'm an e-recruiter here at UC Merced. Allow me to give you a quick overview of Become a Bobcat, a virtual series. So we've been offering this program for a couple of weeks now. We're kind of midway through the Become a Bobcat, a virtual series. We have a few more weeks to go. We do have a website dedicated to this virtual series. Take a look at the website. You can look at upcoming events that will be continuing on, as I said, in the next few weeks. And in the events that have already taken place, we have recorded those and we have those on demand for replay on our YouTube channel. So please take a moment and take a look at that at your leisure and get signed up for some future events. We definitely hope to see you again at a future Become a Bobcat event. Once again, my name is Ricky Hill. Thank you so much for joining us today for this pre-health event. At this time, it is my great pleasure to hand things over to get things kicked off to my colleague, Jen.
Good afternoon. My name is Jen Souza, and I am one of the two pre-health advisors here at UC Merced. And I also am an advisor for School of Natural Sciences for the majors Chem, Environmental System Science, Physics, and Math. So today we're here to introduce the UC Merced Pre-Health Advising program. So the topics we're going to be talking about today. So the pathway to healthcare profession or professions. So we talk about various professions. Our number one is usually pre-med, but we do have others that we do help with. What makes a competitive applicant? Because that is ultimately what the whole goal is pre-health advising, is to help you on that journey to becoming a competitive applicant. Selection of a major, prerequisite courses, experience, UC Pre-Health Advising, professional school admissions, and questions related to pre-health advising, all of the above. So here's the kind of general overview of becoming a healthcare professional. So there is a very similar pattern to most of them. There are some that kind of vary, but we, and that's partially what we assist with as well. So everybody starts out with high school, graduating from high school and attending a four-year college. And there you'll notice we have UC, CSU, private universities, or you can be a community college student and transfer to a four-year. There's no rule that says you have to go to a four-year college to start out with. Then the actual school itself. So after you graduate from UC Merced or any four-year school that you're attending, there's the professional school aspect. And so you'll notice there goes anywhere from 3 to 4 years. The 3 years usually kind of an accelerated pathway program. And you'll notice there we have a list of the healthcare professional schools we're mentioning. So medical school, dental, pharmacy, vet, physical therapy, occupational therapy, and physician's assistant. And then that general professional school is a general overview where you get a chance to kind of experience different types of environments within those professions. And then you have your residency training, which is usually 3 to 5 years, and you can do like specializations. So for dental, you might become a pediatric dentist. For pharmacy, you might want to go into like oncology. So there's going to be different versions of those different aspects of health professions. Then there's the optional fellowships, which is anywhere from 1 to 3 years. So it's considered an additional specialization and advanced training. So like for, you'll notice nursing is not on this because nursing has kind of a different pathway, but like if you want to go in and do some additional nursing to become like a surgical nurse, there are additional fellowships that are, and trainings that are required for that. Then you become a practicing professional, and then the continuing education piece. The continuing education piece is incredibly important because all of these health professions require some kind of licensure. And in order to maintain your licensure and to renew it every few years, you have to have continuing education units because the world keeps evolving and technology keeps evolving with it. And so obviously, you know, medical practices 50 years ago are going to look very different today. So you have to make sure that you're continually learning new strategies. So what makes a competitive applicant? And so what we mean by that is things like strong academics. And so what we ultimately want students to know is when we talk about becoming a competitive applicant, that means we want you to have a competitive GPA. And when we say competitive, that means not just overall, but also science, because that's what these schools are looking for. But when we say competitive, the way that we kind of gauge that is we will take a look at these different schools, and they will be pretty transparent about showing what the average GPA is for their incoming classes and telling you kind of where you're at. So if they say, oh, well, the lowest GPA they admitted was 3.4, the highest was like 3.9, it gives you kind of an idea of where you lie. But it's not just about the GPA. We also have test scores. And so depending on which health profession you're going into, there's going to be the MCAT, which would be for medical school. The DAT is what you call it for dental school, PCAT, and then the GRE. And GRE is going to be more for like physical therapy and for those master's programs. Meaningful experiences. And so most of these programs are going to require some kind of experience in the field. Some programs are going to be actually very specific, where they might actually want specific amount of numbers of hours that you work with in the field. But ultimately, the whole point is we want you to get some kind of experience within the field, because you want to know why. We know that everybody who wants to go into some kind of health profession wants to help people, but that's not enough of a reason. You can't just say that. So we want these experiences for you to be able to kind of gauge what that means to you, like the why do you want to help people and why do you want to help people in that particular capacity. So you could do things like research, community service work, like some of our students work as EMTs or scribes or physician's assistants or pharmacy techs. I mean, it varies, but ultimately we want students to get some kind of meaningful experience while they're in undergrad, and even post getting their bachelor's degree. So the personal narrative, so all of this, especially those meaningful experiences, should be adding to that personal narrative. So the whole point of that personal narrative is for you to be able to communicate commitment and passion for the field. And so when you're picking these experiences, we always get the question of what should I do? And the answer is you need to do something that's going to be ultimately meaningful to you. So you shouldn't be picking something just to pick it. You need to pick some kind of activity that's going to give you exposure to the field you're interested in, but also help add to that narrative. Because again, you can't just say, I want to help, because that again that's everybody's. So you want to make sure that you're picking these activities that are going to help kind of expand on that narrative. And then ultimately articulating why you're a good fit for the profession. And that has to come through when you have to do your personal statement, but also when you ultimately, if you ever have the opportunity to interview for any of these health professional programs, you also have to be able to articulate it verbally. So it's not just on paper, but it's actually verbally articulating that. So one thing we really, really want to stress, and if you take one thing away from today's presentation, is there is no pre-health major. So most students are going to assume that the best major to go into is either going to be chem or bio. Now, I call those paths the paths of least resistance, because it's true, if you decide to go into chem or bio, you are going to most likely fulfill most of your prerequisites for these health professional schools. But that doesn't mean it's a good major fit, because your GPA is so important. We really want you to major in something that is going to be meaningful to you. So something that hopefully, one, you'll enjoy, and two, you're going to excel at. So something that's going to help you give the most competitive GPA as possible. So we have a lot of students that are non-science majors. They're not in STEM. We have public health is a really popular one, psychology. You can major in physical education. It does not matter what your major is, because there is, and as the state said, there's no major or minor that gives one student advantage over the other. So students all the time are coming to me saying, I want to add a minor, I want to stand out. The ways to stand out are do well in the classes you have to take, those prerequisite courses, your major courses, and funnel that energy into those experiences that are going to create the person that you're evolving into to becoming a competitive applicant. So major in anything you want. There's students that have majored in art that have gotten into medical school, because again, it doesn't matter about what you majored in, it matters how you did in the major, but then also how you did in those prerequisite courses. Ultimately, just again, can't stress it enough. You can major in anything, you can minor in anything, but ultimately choose something that you think you're going to get the most out of academically, personally, but also the one that you're going to excel the most in. So here's a list of some prerequisite courses, and you'll notice a few of them actually have some specific health professions there, because I think a lot of students are very often surprised to know that to go to medical school, you actually only need 1 year of bio. You actually only need 1 semester, 2 semesters of general bio, I should say. There's other health professions that require more, but initially 1 year of bio. Most professional programs are going to require 1 year of general chemistry, 1 year of organic chemistry, 1 semester of biochemistry, 1 year of physics, 1 year of math, and usually it's calculus but it can be something else, specifically calculus, 1 semester of statistics, and 1 semester of English. And in all reality, and one of the reasons why we really stress about you can major in anything is because ultimately, if you're in a non-science major, these classes can be taken at other schools, like a community college, for instance. The only one that cannot is biochemistry, which is an upper division course. But that's what part of the pre-health advising is we talk about these things, we talk about your options, and we try to help you maximize your time while you're UC Merced and figure out strategies and ways for you to become the most competitive applicant you can. So additional courses there. So you'll notice 1 semester of public speaking, which is pharmacy, and we unfortunately don't offer that class at UC Merced, so that would be a community college course. 1 semester of economics that's also needed for pharmacy. 1 semester of psychology is needed for just about every single health profession, if not more than 1 semester. So like physical therapy actually requires more advanced psychology classes. 1 semester of microbiology, 1 semester of anatomy, and 1 semester of physiology, and those are needed for nursing programs. Anatomy is also needed for pharmacy school. So we unfortunately don't offer anatomy here at UC Merced currently because we do not have a cadaver lab, nor do we have anyone who can teach the class, so that is often taken at a community college. And there are a lot of rumors out there that mentions these classes and about how they have to be taken in certain capacities. But honestly, as long as you take the class that has the lab and you pass the class successfully, that's all that really matters for these health professional programs. And now I'm going to switch this over to my colleague, Erica Robbins.
My name is Erica Robbins, and I'm the Director of Student Services for the School of Natural Sciences, and I am the other pre-health advisor. So Jen touched on experience just a little bit ago, and I'm just going to give a little bit more information on why experience in the field is so important to the development of a competitive medical school or a health professions application. It's really an opportunity for students to find out what the career is all about. We work with a lot of students who have different misconceptions about a career in healthcare. And I've heard students say like, oh, I want to be like House because he solves problems, or is it like Grey's Anatomy, right? The answer is no. And so you really need to get yourself out there to really understand what the real world working environment in a clinic, in a hospital, in a physician's office, vet office, what have you, what that really likes and what it feels like to you. Through experiences, you can help clarify and validate those initial impressions. So is it a really good fit for you? Is it what you thought it was going to be? Did it feel good to you to be in that space, working with clients or patients and families as well? Through the experience, we're hoping that you'll be able to improve the articulation of your goals. Like Jen mentioned, a clear personal narrative that speaks to your commitment and passion for the field is what sets applicants apart. And that personal narrative should be woven through your personal statement, which is a huge piece of the application, as well as how you communicate yourself in an interview environment. If you don't have experiences to draw upon, you're not going to be a competitive applicant, and it's going to be reflected in that personal statement, and you're not going to be able to get very far. Some professions have explicit required hours. So vet is an excellent example. UC Davis has a set number of minimum hours that they expect students to have in-depth experience with animals. Physician assistant programs also have set number of hours and where those hours can be accrued. So it's really important for students interested in healthcare to go out to the professional school websites and learn what are those requirements, and so that you can start preparing, like how many hours do I need, and what does that experience need to look like? Nothing that you have to do in your first year. We are not asking you to go out and start shadowing or working in a clinic, nothing like that, but it's something you definitely want to be aware of early on so that you can start that strategic planning so you know what you need to do and have under your belt before you actually get ready to apply. And like Jen mentioned too, choose experiences that are appealing and important to you. If you're going into a clinic that you're not really interested in, doing stuff you don't care about, it's not going to be valuable. When you talk about it, it's going to be clear to the person you're speaking with that it doesn't matter to you. And that's not a good use of your time. Like Jen just shared all of those really challenging science classes that you're going to need to take. We definitely want your experience to be something that is motivating to you and something that is going to really add depth and breadth to your application. So how does UC Merced help you? So now that we've kind of gone over kind of the pieces of what a competitive applicant is going to look like, this is how we help you get there. So Jen and I work individually with students. We also provide workshops throughout the semester. but we're there to support you throughout the process and really provide that guidance to becoming a competitive applicant. So giving information on the course selection and planning. The science classes are very sequential and you have to be taking them at the appropriate pace in order to finish everything on time. We're there to help you plan as well. So if you elect to take a major that's not in the sciences, like Jen said, chem, bio, even bioengineering, it kind of all rolls in those science prerequisites that you're going to need anyway, but that doesn't mean you have to major in those areas. If you're majoring outside of sciences, we are happy to work with you and your major advisor, whichever major you are, to make sure that you've got a plan that includes all of your degree requirements as well as the needed preparatory classes for your intended healthcare profession. We help you throughout the entire application process. We help you craft that personal statement, answer questions about the application itself, the secondaries, connect you with resources for interview preparation and everything else, and also just be a listening ear. The process is very long and it's an emotional roller coaster, but we are there to cheer you on. And finally, we connect you to opportunities. We have a really vibrant career center on campus that has connections out in the Merced community. And we're there to connect you with outside resources to help enhance that application. So what are those opportunities at UC Merced? So there's a number of ways that students can start developing right away at UC Merced. So there are on-campus employment opportunities through HEROES, which is a peer health education program. There we go. There's also peer educators in a variety of different offices. For example, we have a peer academic advising program where about half of our former student workers have gone on to some health profession in pharmacy, medical school, dental school, nursing, quite a few opportunities there. The peer advising programs are a really good way to enhance some of those social skills and interpersonal skills. So there's definitely on-campus opportunities that can enhance and help build out your application. Undergraduate research. We are a research institution, and that means that all of our faculty have undergraduate students working in their laboratories. And it can be specifically science, so you could be working in a bio lab, but there's also opportunities to work with the health psychology faculty or the public health faculty. And then we do have a plethora of health science focused faculty doing very differing research studies on HIV, cancer. The LEAD Pre-Health program is brand new for this year. So this is a leadership development program for 3rd and 4th year students, where your students are exposed to different healthcare professions and what leadership looks like in a healthcare setting. Student clubs and orgs. There's a ton of different student clubs and orgs out there. Some of them are career focused and are specifically pre-health, pre-med, pre-nursing, pre-vet, pre-dental, pre-optometry, but then there's also interest focused clubs as well. And so those are great opportunities to develop your network, connect with like-minded students, and the clubs have a lot of resources available. And so they bring in guest speakers, they go on field trips, and there's opportunities to give back to community as well. Paid experiences, like I mentioned in the last slide, the Center for Career and Professional Advancement, which is our career center, works closely with entities in the Merced area and connects students to employment. So there's opportunities on their online database all the time. Medical scribes get posted up there, medical assistant positions, there's others out there too. And so there's opportunities for students to get paid while also building out that experience piece. Community involvement. There's service opportunities, not just with clubs and organizations, but other orgs or other offices on campus that have a community focus. That's another way to build out your community service and also have a clear understanding of what is it like out in the community in terms of healthcare and underserved populations. And then finally, volunteering. Mercy Medical Hospital, which is just down the street from us in Merced, has an emergency room volunteer program. It has been put on pause due to the pandemic, but we do expect it to get back on track and take on students. And so that is a hospital volunteer program in an emergency room where you interact with patients and you can see how does a healthcare team work in real life. All right, professional school admission. So this is the question that we get asked quite a bit. What is the acceptance rate of UC Merced students? The answer is we can't calculate it. So there's there's a lot of challenge in calculating an admissions rate, specifically because students are not obligated to share information with us. So students, they can apply out, but they don't have to tell us that they have, and we don't, and if they haven't released information to us, we won't know what has happened, so, or where they've gone, or much like that. So we know that students are getting in. We don't have a way to calculate that raw number. And I know that this is important for students who are selecting or making that great decision about which undergraduate institution do I go to. We really recommend students to consider how the institution is going to support you as a pre-health student, specifically looking at those research and community involvement opportunities, the academic and pre-professional support available to students, and then academic and pre-health advising. Like where do you feel that you're going to be able to thrive? So UC Merced absolutely provides these opportunities. It is ultimately up to students to utilize them and build out that competitive application. We really recommend students, again, attend the university where they feel they are going to be best prepared and best supported to make that next step after graduation with a bachelor's degree and go into your intended career or professional school. So we've covered quite a bit of material, and I know there's lots of questions, so we left plenty of time. I did want to do a quick plug for our website, which is prehealth.ucmerced.edu. There's tons of information out there on all of the health professions that we support. You can see the exact UC Merced classes that students will be taking for medical school, dental school, pharmacy, vets, all of them. There's like 12, I'm not going to list them all. Our contact information is also out there. If you have additional questions after today, you sleep on it, and then you can shoot Jen or I an email, and we are happy to answer that as well.
Great. Thank you so much, Erica and Jen, for that wonderful presentation. I was looking ahead at some of the questions, and as I would pick one, you guys were answering them right then. So we will definitely get to the questions that are incoming, but that presentation was very informative. The first one I would like to toss out to you has to do with community colleges. Is there any recommendation that you can offer our viewers today in terms of what they can do at a California community college in order to prepare for their transition into UC Merced and into the pre-health advising?
Absolutely. So one of the other hats I wear is I am a transfer counselor, a transfer advisor for students coming into the School of Natural Sciences. So if you're at a community college and you're intending pre-health, no matter what your major, take the science classes, take them there. So get started if you haven't already. Do the general chemistry, do as much organic as you can, calculus, physics, and then bio for majors. Like I mentioned, or Jen mentioned, it's absolutely fine to not major in the sciences, even as a transfer student, but you will be much better prepared if you get those science classes at least started at the community college, so that when you get to UC Merced, we're finishing up anything that's outstanding and getting you into biochemistry.
Great, thank you for that information. And sticking with that biochemistry topic, a question came in that's asking about if a person has already taken biochemistry in a dual enrollment college class as a high school student, is it possible to transfer that biochemistry into UC Merced?
If it's a dual enrollment, it's lower division and is unlikely to be equivalent to our course, which is upper division, so junior, senior level. But our motto is exhaust all options. And so before asking a student to take a course, we will have the course reviewed to confirm.
Great, thank you for that. The next question coming in, how can a student join the pre-health program, Heroes, and Peer Educators programs?
It is a paid position. And so if they have openings, they will have the position posted on the student jobs board.
All right, so the next question coming in, can we touch a little bit more or kind of recap on the local hospital volunteering and clinical experience option?
So the program, again, this is pre-COVID. We can't comment on what it may look like, but volunteers were hired on a 2-year commitment. So sophomores are hired, could apply, and they volunteered in the emergency room, kind of behind the doors. And so they would work closely with a volunteer coordinator to identify tasks for the day. And it would involve working, helping patients with whatever they needed, helping the nursing staff with whatever they needed. So that's what it looked like pre-COVID. I'm not sure what it may look like after that. And I think Derek was a volunteer there, if he's able to hop on and add a little more context.
Hi, everyone. My name is Derek Wong. I'm a fourth-year psychology student who is also pre-med. And I also wanted to talk about the volunteer experience because it was quite an experience and I really enjoyed it. I've been a volunteer there for, it's actually longer than 2 years now. I don't think it's like a contract anymore, but I've been, my first 3 years before like COVID hit and everything, I was actually a volunteer there for the inpatient department. And it was super cool because essentially you are a volunteer. You don't do anything clinical. So like you're not going to be doing like hooking up IVs or anything, or like anything that the nurses really do in terms of the technical healthcare service. But we are there as we are exposed to the clinical environment. So we do get to see a lot of it happen. And if they do require it, we can go ask the nurse to come like, oh, hook up this IV, or like the IV's beeping, and then you can watch them do stuff. And it's kind of cool to kind of be in that environment to see everything like that. And you see the doctors come in and they come and speak to the patients. And then if you're volunteering in the ED department, you can see all the patients come in, and then you're like trying to comfort a patient. You're essentially there as a volunteer for comfort. So you're there to kind of like pick up like patient physician to patient interaction. So that's kind of like a really good experience for learning how to, I guess like act or like perform in a clinical setting while not actually doing clinical work. Because like if you did clinical work, you would need like a license and everything, and that's the only reason why we can really do all of that. But we got like pillows and everything. We got to talk to them, learn about patient concerns. So it was just like a very immersive experience, and I really enjoyed it. And I think everyone who kind of goes through the volunteer experience, they do come out with positive experiences from it. And most of my friends have been in it too. So yeah.
That was very helpful, Derek. And why don't you go ahead and give an introduction since you're joining us now? I know we do have a couple of students on with us.
Oh yeah, sure. Okay. So my name is Derek Wong. I'm a fourth-year psychology student. So I am not a science major and I'm a pre-med. So I plan on being a psychiatrist specifically. So I plan on going to medical school after my undergraduate career. I'm going to take a year off, obviously, because I am tired. Being a pre-med student is very tiring. So I'm currently in my fourth year, almost done. And I'm involved in a couple of things here on campus. So I actually started a club called Breaking the Stigma. It was a club that was geared towards helping the unsheltered population here in Merced and providing resources and such. So that was kind of like a club that I decided to do because throughout college I learned that a lot of my medicine related interests were revolved around underserved communities. And I had a couple of experiences with underserved communities through my involvements here at UC Merced. And then that was how I was like, oh, okay, I'm developing like this desire to help a specific population that I see in Merced. So I actually plan on coming back to the community of Merced and opening up a community health center here for rehabilitative services. So that's kind of like what I'm kind of into. A couple of other involvements. I'm involved in research here on campus. I'm an undergraduate research assistant for the Health Communications and Interventions Lab that we essentially like analyze how people make decisions about like vaccinations, climate change, like what kind of things are appealing to them when deciding the health of themselves and others. So there's a lot that happens here at UC Merced, and those are just like the tippy top of my involvements. I don't want to take too much time away from Giselle either.
Yes, and speaking of Giselle, can you go ahead and do your introduction? We do have another guest behind the scenes that we'd like to introduce.
Hello, everyone. I'm Giselle. I'm a third-year public health major. It's really nice to meet you all today. So similar to Derek, being in pre-health, my interests really lie in going into graduate school after, so definitely going the opposite direction and obtaining a professional degree. I tend to want to focus more into low-income populations here in the Merced community and opening up into like health centers and kind of connecting the low-income population to healthcare accesses and healthcare services throughout Merced County and the Central Valley. So that's a little bit about me.
Great. Thank you so much, both of you, for joining us and for being a part of our panel. Feel free to hop in at any point if you do have other tidbits of information or helpful hints, tips and tricks for our audience. That would be very helpful. All right, let's take a look and see what other questions we have here. So we do continue to get more questions about volunteering. So can one of our panelists speak a little bit more? I know we've touched on it a bit, but we're getting that same question coming in, talking about what type of volunteer opportunities we have. And we can also toss into that question internship opportunities.
So I can talk a little bit more about the internship opportunities here that UC Merced does offer. So for a lot of our students, aside from volunteering at Mercy for pre-health, you can also do research on campus. And so those research opportunities are endless, as there are a lot of faculty within public health and the School of Natural Sciences for bio, for students to take part and kind of gain more experiences with working with the community, or kind of like working behind the scenes and making that impact with the community. So graduate students, professors, and other faculty on campus are always looking for students to help out. We also have the UROC program, which allows students to create a research project over the summer that does help them kind of expand upon their interest. That's another cool program that students can take a part of and kind of like also grow and expand upon what they want to do, and kind of figure out if that's something that they can see themselves doing, going more toward a professional degree or going more towards a medical degree moving forward.
Very good. Thank you so much for that. Now we do have a question coming in regarding the workshop that we do offer for the first semester. Erica, would you like to take that one?
For all new students to pre-health, we do require them to attend an introductory workshop before making a one-on-one appointment with either me or Jen. And the purpose there is the introductory workshop is going to cover kind of the basic nuts and bolts of the profession, what courses need to be taken, the standardized tests that need to be completed, and kind of the timeline, and what are those like granular application components that students need to be aware of as part of the preparation for the intended profession. So we offer those every single semester. We don't have our fall schedule out yet, but we will get those up. They will most likely be Zoom, so you can sign in just like this, totally accessible anytime or during the session for the live feed. And then we do have recordings after the fact as well. So we do require students to attend those first. Once you get that done, then you can make a one-on-one appointment with me or Jen, and we can sit down and answer your individualized questions, look at talk about your motivation and what your timeline looks like, because it is unique to everybody. Jen, do you have anything to add? Anything that I missed?
Yeah, so because I was trying to answer the Q&A stuff as much as possible. So just as a follow-up, I did mention to some of the students that there will be an email going out. Eric actually is the one who does send that out in June, I think it is, where it's asking if you're interested in being part of the pre-health listserv, which means that you be part of the emails that go out that are related to pre-health, any kind of introductory workshops, any kind of programs that are coming on, basically anything that's related to pre-health. You join the listserv, you get those emails. So that will go out in June. So if you're interested in pre-health, I would definitely sign up for the listserv. Then the first week of classes, we try to put on 1 to 2, depending on, circumstances. We try to put on 1. If it's going to be virtual, it'll probably be 1. But we try to put on a really big introductory, like all-inclusive workshop, where if you do attend that first week, then you are officially going to be part of the pre-health program. We don't call it, I notice some people say pre-med, it's pre-health. So we don't specify just pre-med. But we definitely want you to attend that workshop. There are the individualized introductory workshops, so like introductory to pre-med, to pre-dentistry, everything else. So we do those throughout the semester. But the one that's going to be the first week will just be kind of all-inclusive, just so we can hit as many students as possible, so we can get them into the program right away. Also, I had some students asking about academic advising in general. So you'll always have, no matter what you major in, you'll always have your academic advisor. So because you notice both Derek and Zell are both non-science majors, so they have their academic advisor for their major courses, but you can come to us for any of the pre-health related coursework. So you'll always be working with kind of 2 different advisors for different capacities, because we want to make sure that you're getting, the most out of your experience here at UC Merced. So hopefully that answers like how to get in, because I know there was a lot of questions about that. So we try to make it as simple as possible, but that if you watch out for that first week, you attend that workshop, then that's going to be the quickest way to get into the program. And that'll be usually like the day before classes start is usually when we try to have that.
Very good. Thank both of you so much. So another question that's come through here, and it was answered behind the scenes, but I'd like to mention it in the live. So do we have any information on students who have worked as EMTs, if they were able to keep up with their job and their classes? So I'd like to expand that a little bit more too, in pretty much any job, and also manage their coursework.
So I was actually answering that question as well. So honestly, working and going to, like, being a college student is already a full-time job. And if you don't know that yet, you will soon enough. But when it comes to being a pre-health student on top of it, it's kind of almost like a double whammy. So there's a lot of work, especially if you're a non-science major. So what we're starting to see more as a trend is students taking anywhere from 1 to 2 gap years, because it is difficult to work and go to school and get these experiences under your belt and try to manage it all, because to become a competitive student, you have to really focus your time and energy into places. So if you talk to a lot of students that are going into these health professions now, a lot of them have the same situation where trying to get everything in order by the time they graduate is a lot. So what used to be kind of a negative thing, which is what we call a gap year, a lot more students are taking advantage of. So then it gives them time to focus on their academics while they're still in school. And then after the fact, gives them that time to gain that experience and to kind of funnel their energy there. And I'm sure Derek and Giselle can kind of also mention how they manage all of that.
Yeah, so I can talk a little bit about that. So being a pre-med student, again, I said it's very tiring. So that's why I actually decided to take a gap year, because my original plan was like, oh, I'm going to do all of this and then apply during my 3rd year and get my acceptance my senior year and then attend school right after. And then like once I got to my 2nd year, after being involved in everything, like the things that they require from you in order to apply to medical school, like everything that was being talked about earlier in the presentation, that is all required. Required. So they don't put it on like their website like it's a requirement, but it's definitely something that they expect you to have. So because of that, you throughout your undergraduate years, you're going to spend a lot of time doing things like, currently I'm working as a scribe, so that's something that I'm doing. It's a lot of work. Like becoming a scribe itself is like it's like taking a whole nother class on top of your course load. And then I also have another job. And then it's like I'm doing all this stuff and it's like, when am I gonna have time to write like a personal statement, take the MCAT, study for the MCAT, do all this stuff? And it's all this stuff happening at the same time. So how I kind of manage it is like I've decided to take a year off just to like do all of that extra stuff on top of aside from my coursework. And then Google Calendar. So Google Calendar is one of the most helpful things that I've ever experienced here in college, because like you get so caught up in your extracurriculars and you get caught up in your job, the new job, or in medical or in the hospital. So it's just like there's all this stuff happening and you're like, oh shoot, like I have a class, huh? Like I have a class right now. So I end up putting my class in there, my study time, my homework, nap time, all these kinds of things, just because there's always stuff going on. Okay, yeah.
And Derek brought up a good point, because scribing is another really popular popular way for students to gain some experience. If you don't know what a scribe is somebody who works directly with a doctor, taking like kind of shorthand on when the doctor is doing their work. So basically they're taking notes on how the doctor is working with the patient. So like in the ER especially, they get a chance to kind of explore all the different types of medicine that, like pediatrics, oncology, like they do a little bit of everything in the ER. So but I think Derek, and just even like the way that Derek even presented it, we're never trying to scare anybody, but I think Derek is a really good example of how hard it is. And there's a reason why it's very difficult, and where Eric and I very early on try to help you try to figure out what the balance is. And when we have students coming to us and they say, well, should I do this? Should I do that? Ultimately, yes, scribing could definitely be way more flexible, you're right, and probably a little less stressful. But ultimately what we want students to do is they need to figure out what works and doesn't work for them. So we're here to give advice and to kind of help you shape what that journey is going to look like. But you have to figure out your limits. You have to figure out what you can and can't handle when it comes down to it. So we always want students to kind of recognize that and to figure out, yes, what's the best course of action for each student individually.
Wonderful. Thank you so much. So I'd like to transition into a question that has to do with how can our students that are within this pre-health major, and as Derek mentioned, getting ready for med school and those types of things. So you're super busy, but how do you find a support system among your classmates? Is there something set up for any type of networking? Maybe it's a club or organization?
Derek or Giselle, are you guys part of any of the pre-health fraternities or program or orgs? If you want to talk about them.
Yeah, so I thought Giselle was going to talk first, but I guess I'll go first. So I'm actually a part of Phi Delta Epsilon, which is a medical fraternity here on campus, and that has been the single most like helpful resource for me, just because it like kind of provided everything for me once I got here to college. I actually joined my freshman year. So when I first got into Phi Delta Epsilon, it was like a myriad of like the job opportunities. They offer research positions, so a lot of them are in labs. And then whenever they're in labs, they bring it back to chapter and they're like, hey, there's like a lab position opening for this professor. Like she wanted me to ask you guys before she opened it up to the community. So we kind of had access to that research position before everybody else did. And that was kind of like a cool little thing. And then we also got to meet a lot of doctors. I have a lot of personal connections with doctors now because of through Phi Delta Epsilon. This is like a total like shameless plug. I'm so sorry, but PhiDE was like a super good resource for me. But if you do not want to join a fraternity or like that's not really your vibe, but I just want to like talk a little bit more about that later in case anyone has any questions, because it's not like how they display in movies. It's definitely not like that. But the fraternity is co-ed, so there's girls, boys, anyone of any gender is able to join, and we're like a very close-knit family. I know a lot of people were going to say that once you get to college, but we really are. And there's just a whole bunch of opportunity that came from that. There's also Pre-Med Central. So Pre-Med Central is a club here on campus. And once you join that, you get access to a lot of different material or resources as well. So they also offer like job opportunities, research opportunities, all those kinds of things. So yeah, those are like the two big ones that I'm a part of. I'm also a part of the Society of Medical Sciences. So that's like a journal club where we talk about medical journals and the different applications for them. So that's like a cool thing because it's like you start to read scientific articles and you're like, okay, but what does this mean? And then the Society of Medical Sciences is kind of like they teach you like, oh, this is what you could use it for, and this is what a lot of people have used it for. So there's a lot of resources here. Those are like only three orgs that I've named off so far, but there's like 17, 20, probably more than that, because there's like they start the table and like you can't even remember all of them just because they're all there, but you'll eventually pick one that you think is like the most suited to you, and that's the one you end up joining, and they give you opportunities and a family here at UC Merced.
Wonderful. Thank you so much, Derek. And Giselle, did you have something to add?
Just kind of similar to Derek. When I'm on campus, a lot of the resources that are involved are like, for me, are through research. And so being involved in active research on campus and having been a part of the UROC program and going through the SURF program in particular, there's always study sessions. There's always information of when there's different events to help you kind of like guide your career path, whether it's in medicine, whether it's in grad school. I really like how it's like every time we have a study session, we connect with each other and we share opportunities to kind of uplift each other, as well as just like hold study sessions throughout the semester. When we do like remote study sessions where we get together, we help each other out, we study with each other. If we're in the same classes, it's even better because then we're preparing for our exams together, we're reviewing, and then we're helping each other out in like different ways. So I definitely love kind of like the campus environment that no matter what organization you're in, you always have someone there for you, or a group of people there for you to help support you and kind of make sure that you're not only on top of your grades, but you're also very sure of like what you want to do and kind of have that secondhand opinion of where you're in and like how to get there.
Wonderful. Thank you so much. And I know we did have a question just clarifying, Derek, you had mentioned a club or organization. So this is for everyone, actually. If you have mentioned anything, if you can drop either the name of it or any type of contact information, social media, website, anything like that, if you can drop that into the chat for our audience and they can reference that and make a note of it, that would be great. All right. So the next question I'd like to toss out, let's see. Can students take pre-med requirements abroad? So anything related to study abroad, how would that apply to UC Merced?
Yes, there can be. There is a process that has to be gone through. So it's not that simple necessarily, but when students are exploring options for studying abroad, they can meet with myself or Erica to discuss what kind of classes they can look into. We do have some classes already in place, or they're already some of those prerequisite coursework for natural sciences in general, but also would be pre-health required courses as well. So we do have an already running list. And then if a student is interested in pursuing studying abroad somewhere that we don't have a list of courses, then they can always submit to be reviewed by faculty. And so basically what we're looking for is making sure that the faculty is looking for like kind of like a one-to-one articulation. Is there enough coursework? Is there enough information? Will it translate to our course? And so typically students will usually focus more on their major coursework. And so it depends on the student themselves, but yes, it's definitely something that's an option. And we would encourage students to speak with their academic advisor about major specific coursework, and then also pre-health coursework with myself or Erica.
Wonderful, thank you so much. So the next question, How many students are assigned to one academic advisor? How many are you guys responsible for?
So to kind of recap, Jen and I are pre-health advisors. And so for each of us, we work with about 325 students one-to-one. So you can get a hold of us in a variety of different ways. You're also assigned a major advisor, and then sometimes a minor advisor if you've got a minor. And so that ratio can vary depending on which major you're in, but overall the average is about 1 to 350.
Very good, thank you for that. So another question that's come in, are all prerequisite courses at UC Merced, or will students need to possibly take them at another university or college?
So that's going to vary depending on the pre-health profession you're wishing to pursue. So a couple of the courses I specifically identified that we don't offer would be public speaking, for instance. We don't offer communications courses at UC Merced. So that would be something that could be taken at a community college. And then anatomy is the other one, but anatomy is not actually needed for medical school. Most students assume it is, but again, I try to iterate that you only need one year of general bio to go to medical school. You actually need more chem than anything else, which is actually usually really funny. Anatomy is needed for pharmacy and dental school, so you can, and physical therapy or nursing. So you would take those, you could take that particular course at a community college. But for the most part, everything else we usually offer. And if there is something specific that we don't offer, then we always direct students to the correct place to take it.
Again, work one-on-one with students. And so it's possible to take courses at the community college during the summer. So if you're going back home and you want to take, Chem 10, we'll help you triangulate what course at which community college will meet that requirement. And so, we're always available to work with students on their individual situation and needs.
It's not uncommon for our non-science majors, like our Shaw majors, like public health or psychology, to take some of those classes during the summer because they want to, be able to focus both on their major courses during the regular semester. So we definitely we assist students one-on-one for that reason.
And I like Derek's comment in the chat there. UCLA explicitly discourages students from taking anatomy. So there's that.
Good to know, helpful tip. All right, the next question, actually, it's not so much a question. I would just like our student panel to talk about their experience with research.
Definitely, research is a really good opportunity to get involved on campus just because you gain a lot of different skills, both professionally and also as a student willing to go to graduate school or medical school. It does give you a higher, I think, background and advantage because you are starting to expose yourself to working with communities. You are having you're doing something that's within your field that gets you to look more competitive. Having done research myself in UROC, though there's so many different programs, I did the SURF program, which is open to all different disciplines. Having done research on active mosquitoes and how that was affecting the Merced community and how our health as a population is affected more than there is in bigger cities like San Francisco or Los Angeles, and looking at that data comparison and presenting that to the community made an impact because there's different ways of keeping ourselves healthy and educating others. So definitely it opens a lot of doors. It helps you kind of get involved and make connections with other people within the UC, but also outside of our campus and within our sister campuses. So definitely does open up a lot of opportunities and kind of gives you a new perspective and a more holistic perspective of what you can do and how else you can do it, and just learning from others.
Thank you so much, Derek. Did you have anything to add to that regarding research?
Yeah, so research is actually super helpful, as Giselle said. So for me personally, research kind of got me into a lot of these. Well, I wouldn't be reading scientific articles if it weren't for me joining the undergraduate research lab. But joining a health psychology lab kind of made me realize there's a lot, as Giselle said, it kind of exposes you to a lot of different things and a lot of different communities. So I've been doing a lot of work with communities that are around Merced, and we actually did one about adverse childhood experiences, which is trauma, all those kinds of things that happen when you were younger and how it affects you at a later age. And just seeing how different things about psychology, something that I really love, connects to medicine is super cool, because it's did you know that adverse childhood experiences cause you to be 20 times more susceptible to developing a heart condition by the time you reach the age of 60. So that's kind of like something that the lab found out. And I'm like, oh my gosh, like that's so cool. And that kind of got me into like research more about like cardiology and things like that, and like how it can affect certain communities more than other communities because of like different types of public health related social factors. So that's like it's like a cool thing that kind of supplements your knowledge about what you already know about medicine. And I think that's what like medical schools are trying to look for too. It's like, oh, this person knows about like how psychology affects like your physical body. And it's just like it really is like a benefit to you specifically, and it's like your education or your academics don't really stop when you leave the classroom. It's like it's something that you do on the side.
Just because not to discourage students from any students from doing research, but research is not required as part of like the pre-med health track. Or usually we want students to do research because there's so many research opportunities on campus. If it's something you really want to do and you really want to gain something from, we highly encourage it. But there's this misconception that it's required, and we don't want students to engage in research, nor do the faculty want you to go do research just because you think you have to, because that defeats the purpose of doing it. So we encourage it. We want students to take the opportunity because it's there, but it's not necessarily required. So just kind of wanted to put that plug in there.
Thank you. That's a very important tip for everyone to know. So it's a nice to have if you're interested, but not mandatory. That's very helpful. Thank you. So the next question I'd like to toss out to our student panel as well. So Derek, we'll start with you since you just did the last one, then we'll hand it off. So has UC Merced prepared you or made you feel confident in going to or being accepted into med school?
Yes, absolutely. I definitely think so because throughout my experience here at UC Merced, I've definitely had lots of exposure to all different kinds of specialties in medicine, and I've gotten to learn a lot about medicine as well because there's a lot of events that go on that are medicine related that I kind of attended from different organizations. And because of all of that, I kind of know like my path to medicine. I feel comfortable. I'm not like stressing over the application because it's like I know I'm going to do well if I really focus hard enough. So it's something that I kind of feel like I conquered, and I can, feel comfortable kind of stepping into it. But yeah, I think it's like the uncertainty that gets a lot of people in terms of like, oh, is it going to prepare me, because they feel like they're not doing enough, and then they're like, but once you get involved and you find like a passion in something, that's something, or especially here at UC Merced, just because there's so many different paths you can take in medicine. Once you find your own path and you feel comfortable with it and you feel passionate with it, that's like when you know that you're kind of ready to like apply to medical school. For me right now, I know that I'm not ready right at this moment just because I feel like I need a break, I need a vacation. But from everything here at UC Merced, all my experiences here, I can comfortably say that I'm comfortable with like my path to medicine and like my ability to kind of get there.
Same here. I feel like UC Merced really did prepare me in different mediums in different ways, where in terms I would be applying to graduate school just because I feel like the resources, the support, and kind of like the outreach that has been done to open up different opportunities for me makes me feel almost ready to apply to graduate school. Definitely going to take a gap year after graduation just to kind of enrich myself more with community and health, just because it helps me better understand what I want to do moving forward before applying. But definitely I can say I'm really feeling confident of UC Merced preparing me for the next chapter after graduation.
Great. Thank you both so much for that. So the next question has to do with summer session. So I will toss this one out over to Erica. Can you touch on summer session and if it's beneficial for students to take classes in summer?
Absolutely. So if you're interested in UC Merced summer session, that is a great place to get started. So my recommendation would be to first connect with the Bobcat Advising Center if you're an incoming first year student, or if you're a transfer student, you could get started in summer session as well. Get connected with your major advisor so that they can take a look at your placement, your transfer credit, everything else, have a conversation with you about your goals and help you select a course. So summer session, I think there's going to be some links put in the chat there too on how to apply as an incoming student. Again, it's a great way to get started, kind of launched into that fall semester and get ahead on your classes. We also have the Summer Edge program, which is skill development in writing and math. And that is going to run for 6 weeks, and it's all online. Summer session is also online this semester as well. So you've got a couple different ways to get started, and again, get a leg up and start your experience as a UC Merced student this summer instead of in the fall.
Very good. Thank you so much for that summer session information as well as Summer Edge. We will go ahead and place those links into the chat for you. There's a very comprehensive website there that will tell you the cost of that, the coupon code that we are offering, if there are still spots available, and everything that you can learn. Excuse me, it's a 6-week program, so you can take a look there and how to get registered and the different next steps that are after that. So at this time, we have reached the end of our session. What I'd like to do is give this back to our advisors, and if either of you have any last minute words that you'd like to offer, advice or tips or tricks, and then also if our student panel have any last minute things that you guys would like to share as well.
Just, if you are very much interested in joining the pre-health program, we accept all. There's no cap or limit. So that is something that I saw a lot of questions about as well. So the email about the joining listserv will come out later on this summer. So keep your eye out for that. It'll be, everything will be through your UC Merced email, everything, not just pre-health, but everything related to UC Merced, including financial aid, everything. Please read your emails. And you'll get that about the listserv. And then once you get the listserv, like I said, you'll get information about joining any kind of introductory workshops that we'll be doing, so you can be officially a part of the program. And then if you have general questions in the meantime, you could always email us. We're happy to answer, general questions. And we do have a website, and the website was on there. And we do have individual pages for each of the pre-health, our common pre-health professions that we do advise on. So you can just even see a general overview for each of those.
And I just echo everything that Jen has already shared. UC Merced is a great place to come as an undergrad, and we have churned out a variety of healthcare professions over the last 15 years. Holy cow. So if you have any additional questions after today, our website was shared. You can get our emails off of the website there on our Contact Us page. We're happy to answer any additional questions that you have.
Great. Thank you so much. Do either of our student panelists have a last minute word that you'd like to share before we wrap up here?
I just wanted to say thank you for joining us, but also just whatever path you decide to take in pre-health, whether it is graduate school or medical school, just know that you are supported here at UC Merced by other students, by our faculty, because we are here to uplift each other and just kind of like wish each other the best.
Yep, for sure. I definitely double what Giselle said, and I see a lot of extra questions coming in. If you have any additional questions, just because we don't have enough time right now, feel free to reach out to the Office of Admissions and ask too, because that is an available resource. And then if you want to speak to me or Giselle either, you can find the admissions email.
admissions@ucmerced.edu, and we will place it in the chat.
Thank you. Yes. And then if you have any questions specifically for me or Giselle, please feel free to email them, and they'll relay it to us, and we'll try to answer it the best we can.
Wonderful. Thank you all so much for joining us, all of our attendees, our viewers out there, and the great expert panels that we had, both student and professional staff. So what I'd like to do right now is give you just some quick information in case you didn't happen to see it in the chat about that Summer Edge program. So the first 250 students to enroll in each of those courses, you can use a discount code of El Capitan 150. And on that website as well, you can find out more information about that. The link is in the chat, but it is summeredge.ucmerced.edu. The courses that you have an opportunity to take during that 6-week time frame would be math and writing. Courses are usually about $150 a piece, so it is worth your time to take a look at that website and find out if that would be a good match for you, and definitely make a note of that coupon code. All right, so at this time, I would like to just once again thank our expert panelists and all the attendees that have joined us today. This event has been one of 40 different events that we are offering during Become a Bobcat, a virtual series. Once again, we do have a website for that as well. Lots of websites coming at you today. Take a look at Become a Bobcat website, find out which sessions that you may have missed over the last couple of weeks, and take a look at those replays through our YouTube channel. Or also, more importantly, you can take a look at upcoming events so that you don't miss out on those. You can get yourself registered. We still have a few more weeks left for Become a Bobcat, a virtual series. Also, lastly, I would like to mention to you the opportunity to take a drive-through tour. We're so excited to be able to bring this opportunity to you, where you can drive to our campus, stay in the comfort of your own vehicle, and get a drive-through tour. We have many different tour stops. You can scan a QR code and get a live, pre-recorded, but a live information from a tour guide video, and that will be giving you all the wonderful facts and figures and just information from their experience based on their experience at our campus and about our beautiful buildings and everything that we offer you at UC Merced. There is a website available that we will drop in the chat for you. There are specific dates and times that drive-through tours are available, so take a moment there as well to get yourself registered. My name is Ricky Hill and I'm an e-recruiter here. Once again, thank you so much for joining us. We hope to see you at a future event. Have a wonderful day.